Hello everyone, Dr. Cary Yurkiw here, and welcome to today's live webinar called Back Pain Live. And if you have back pain or you know somebody who has back pain, please encourage them to join us on today's webinar. We'll be doing more of these live webinars so that you can ask questions. If you're in the YouTube channel right now, you can type in the chat. I'd be happy to answer your question. If you're in the Instagram live right now, you can type your question in the chat and I'll be paying attention to that too. But this is the first time we've done this simultaneously where we have the YouTube and the Instagram going at the same time. So today I wanted to talk about back pain and what we see in the clinic. And often patients present to the clinic with back pain that either is from an injury, so it's short-term pain, so we call it acute as a chiropractor, or it's been there a while and it continues to fluctuate. It comes on, it goes away, comes back, and it starts to get worse. So we call that chronic in the clinic. So we see acute back pain and we see chronic back pain due to different reasons. And what we want to do in the clinic is first get a good history of what's causing that back pain. So we want to make sure that we understand what the cause of it is for the patient, and then we want to do the right treatment for them. So we're going to do the history, we're going to do an examination, and then we're going to let the patient know what we found out and then start treatment. And usually we have a treatment plan for it. So we'll say, here's what we think it's going to take to get you to reduce the pain or get out of pain. Here's what we need to do to restore the function. Here's what you need to do to help your function and your alignment. And here's some other tips for you that you can do at home for your lifestyle and just for to support the healing process. So there's a number of things that we talk about in the clinic as far as the process of healing and restoration goes and how we're going to help that person with back pain. I'm going to read from my book today, and this book was published on Amazon, and it's called Back Pain. And I'm just going to read from the introduction so you can get a better idea of what we do in the clinic and my view on back pain. So, introduction, back pain and the common cold are the top reasons for doctor visits. Certainly, in my clinic over the past 25 years, back pain is the number one reason that people come to see me. Back pain can be treated successfully even when previous attempts have failed and the condition is chronic and long-standing. I believe that each patient's circumstance are unique and that two patients may come in with the same kind of condition but have different symptoms. They may need different treatment plans to correct their back problem. In this book, I'll share my experience treating different causes of back pain and my approach. Patients initially are taken through a complete history, examination, testing, and then diagnosed correctly. Then we begin the process of treatment, which includes going through phases of care, including relief, correction, and maintenance. Patients increasingly take responsibility for their health as the treatment progresses. I believe educating the patient is important for better self-care and to make better health decisions long-term. Patients also need to understand their symptoms and what causes their symptoms and what the symptoms are telling them about their health condition. So our bodies talk to us, and it's very important that we pay attention to that. And often the symptoms will present early on in the process, and it's like a warning sign, a red flag that you should be paying attention to. I know patients initially just want pain relief when they come into the clinic, but pain is just the tip of the iceberg. Pain is a clue that there's something else much deeper that the patient needs to pay attention to. And the sooner the patient pays attention to the pain and the underlying problem, the better. The faster I can start working on the back pain when it presents, and the better the chances are of stopping future reoccurrences and spinal degeneration, otherwise known as osteoarthritis. So often people come in and say that they have an arthritic condition. Usually it's an osteoarthritic condition. It's wear and tear of the spine. There's been imbalances for a long time, and It's kind of like tires on a car where the tires start to wear out on one side faster than the other if the alignment is poor in the car. Sometimes we'll have patients come in with rheumatoid arthritis or maybe psoriatic arthritis, and those conditions do present to the clinic, but by far the most common arthritic condition we see is osteoarthritis. So back pain can have far-reaching effects on general health. The spine is the core of the body, and problems in the spine can affect the nerve flow going through the spinal cord. Also, muscles around the spine, discs between the bones, and nerves that come out of the spine are affected by poor posture and spinal misalignments. So just reading, if you're on Instagram, I'm just reading from the book I published on Amazon called Back Pain. We're talking about back pain today. If you have any questions, feel free to type in the chat. And I'm just going to switch back over here on YouTube to our slide. And if you're with us, if you have any questions, feel free to ask your questions in the chat. I'm just going to check the chat here. I want to thank you guys for joining me today. This is something that we we just started doing, is the Facebook Live, and today we're doing it simultaneously. So we're doing it on Instagram Live right now and on YouTube Live. I want to thank you guys for joining us today. We plan on doing more live events like this so you can get a better understanding of how we help people in the clinic, and more about me as a health professional, as an author, what my experience is like over 27 years of practice, and the thousands of patients that we've been able to help in the clinic. So thank you again for joining me today. Hope you have a wonderful day. And if you want to book an appointment in our clinic in Kelowna, feel free to click on the link in the post, or you can scan the QR code on our slide. The QR code is the Scan Me code in the corner. Just put your camera over that with your phone, and it'll take you right to our booking site, and you can book an initial consultation with us. Thanks again for joining us, and I'll talk to you guys soon.